Welcome, everybody. Thank you so much for joining us today at our Policy and Advocacy Forum monthly call. Today, we are very excited to have our guest speaker, Liz Scott, who is joining us as the Senior Director of Nationwide Advocacy and Clean Air at the American Lung Association. Liz serves as the Lung Association's lead clean air lobbyist and oversees a team of subject matter experts in outdoor and indoor air policy. Liz joined the Lung Association in 2020 and leads the Lung Association's efforts to educate federal decision makers on the health impacts of air pollution and to support policies that achieve healthy air for all. This also engages Congress on priority legislations related to air quality and climate change, as well as advocating for robust funding for the Centers of Disease Control and Prevention, the Environmental Protection Agency, and other public health considerations in the federal appropriations process. This also represents the Lung Association before regulatory agencies, including the EPA on Clean Air Act rulemakings, and provides strategic leadership in advising state advocacy staff engagement on federal air and climate policy issues. Prior to joining the Lung Association, Liz was in campaign organizing and fundraising, overseeing statewide electoral efforts. She shares with us that she is a graduate of the College of Charleston. Today, Liz is going to go ahead and speak to us about how progress towards zero emission transportation, including electrical vehicles, is being threatened by federal actions and what the different regulatory mechanisms are. Things like greenhouse gas standards, the CAFE standards, and tailpipe emission standards, and why it's important the community continue to advocate for a healthier transportation future. Thank you so much, Liz, and I'll let you take it away.
Thank you. Thank you for the introduction. So yes, I was asked to talk about some transportation related advocacy and things happening in the transportation sector. Unfortunately, there's a lot. So I have a few slides to run through. So setting the stage first, I know that this is a group that knows more about the issue of transportation pollution than most, because of course nurses are responsible for treating a lot of the symptoms that come from transportation pollution. But just to ground us in why it is important to reduce pollution from this sector, the Health Effects Institute has put out research over the past few years talking about how dangerous this specific type of pollution is. The panel of experts found with a high confidence that there are really strong connections between traffic-related air pollution and early death due to cardiovascular diseases. They also found a strong link with lung cancer mortality, asthma onset in both children and adults, and acute lower respiratory infections in children. So traffic-related pollution in particular is dangerous and deadly. And then unfortunately, a lot of people are exposed to it. In 2022, the EPA put out a report showing that 72 million people live near truck freight routes. And those living near the high traffic roadways had higher rates of health harms. And of course, as we have seen, the residents of these communities are more likely to be people of color and have lower incomes, making reducing traffic pollution and cleaning up the transportation sector an environmental justice issue. So there is a solution. A few years ago, the Lung Association did a report that looked at the benefits of a transition to zero emission vehicles by 2050. And what our modeling was, it was modeling a totally zero emission transportation sector powered by a zero emission non-combustion energy sector, and what the benefits would be by the year 2050. And what it showed was over 90% reductions possible for the smog and particle forming NOx emissions, as well as greenhouse gas emissions. To underscore even further, we know that heavy duty buses and trucks, so the heavy duty sector, they make up a small share of the on-road vehicles, so the number of vehicles that are traveling on the roads, but they generate over half of the emissions. So not a ton on the road, but they're generating a lot of pollution. They are also a leading driver of dangerous NOx pollution. And so the model that we had showed that the zero emission heavy duty vehicles account for 89% of the reduction in NOx. We also note that there are major greenhouse gas reductions that are to be had from the light duty sector. So these are the passenger vehicles. The light duty sector is transitioning to a zero emission light duty sector, accounts for 63% of the on-road greenhouse gas reductions in our model. So that's our context. Traffic pollution is dangerous and deadly. There is a solution in a transition to zero emission vehicles, and modeling supports that solution. The other thing that I will mention, we focus a lot, or the report that we did focused obviously on zero emission vehicles, but it's not just transitioning to zero emission vehicles that will have an impact. There are, of course, other actions that can be taken, like improving the efficiency of combustion vehicles to help control their pollution more, as well as other policies in the sector, like improving transit, walking, and biking access, and other ways that would aim to reduce vehicle miles traveled. So there is the need to transition to zero emission vehicles. That is imperative, but there are things we can do along the way that will help to reduce pollution as well. So unfortunately, our current decision makers don't necessarily agree with the massive benefits that would come to not just our health and our communities, but also our economy with cleaner vehicles. And so they have been actively working to dismantle a ton of progress. And so I'm gonna go over the topics here in the following slides. I'm gonna go into more detail defining what these mechanisms are. So from the Congress level, Congress has eliminated fines for fuel economy standards violations. They have eliminated the tax credits for electric vehicles, and they have nullified the waivers that California has had to set stronger vehicle standards, which is an authority granted to them under the Clean Air Act. At the agency level, we are expecting proposed new weaker fuel economy standards, and then as well as the repeal of the greenhouse gas standards from all types of vehicles. So let's dig into each of these a little bit more to define it. So on the fuel economy standards, the National Highway Traffic Safety Administration, or NHTSA, is housed under the Department of Transportation. So when EPA issues standards that deal with how to make the vehicle sector overall less polluting and more efficient, NHTSA issues concurrent standards that deal with how many miles per gallon vehicles need to hit. So these are called the Corporate Average Fuel Economy Standards, or CAFE standards for short. So both Congress and the agency have done things here, or are doing them. So as part of H.R. 1, the reconciliation bill that passed earlier this summer, Congress zeroed out the fines that are issued to automakers that violate CAFE standards. So they essentially are pulling out the teeth of any enforcement mechanism. Then, as I said, we're also awaiting a new proposed rule from NHTSA that is currently over at the Office of Management and Budget that will likely further weaken the fuel economy standards. So not only will they take away the enforcement of any violations of the standards, we also expect that they will weaken them even further. So that is currently at OMB under review. I did see an article come out like an hour before this or so, saying that they're planning to move that rule ahead in the next couple of weeks. So we are expecting to see something soon on these CAFE standards. Moving to the tax credits for EVs, the Inflation Reduction Act, which passed in 2022, I know many people are familiar with it, saw tax credits for both new and used electric vehicles, as well as tax credits for commercial clean vehicles. So these helped make EVs more affordable to individuals and families that otherwise would not have been able to purchase one. And then also it helped to ensure that commercial buyers of vehicles were able to purchase cleaner versions. Unfortunately, also part of that reconciliation bill from this summer, Congress accelerated the phase out of these credits, both the consumer for EVs as well as the commercial clean vehicles. These credits were initially supposed to expire at the end of 2032, and the acceleration meant that they have now expired. They expired on September 30th of this year. So there are no longer tax credits that people can utilize to purchase electric vehicles. So California waivers, this is a big one with potentially a lot of consequences, and it's a bit wonky. So I'm going to spend a little bit of time here, and I'm happy to maybe try to answer some questions. So under the Clean Air Act, California has had the authority to set stronger vehicle standards than the federal government. So the California Air Resources Board, or CARB, goes through a rulemaking process, and then they submit a waiver to EPA to say, hey, we want to set up these standards instead of what EPA puts out. And then EPA would then grant that waiver, which allows the rulemaking to move forward and be implemented. This is granted under the Clean Air Act, given California's unique challenges when it comes to air pollution. California consistently ranks our Lung Association State of the Air report as the most polluted cities and metro regions. And so California traditionally has done a lot more than a lot of other states to try to control their air pollution. And they've made a lot of progress, which is important to note, but they still face a lot of unique challenges given the size of the state, the fact that they have wildfire issues, and a lot of transport. So this is an authority that the Clean Air Act has granted California. The other tenet of this provision is that other states can then choose to adopt California's stronger standards. So these are called Section 177 states, which refers to the section in the Clean Air Act with this provision. So in 2024, I think the latest numbers that I had were 11 states, in addition to California, had adopted what they call their Advanced Clean Cars 2 rule, which is standards for passenger vehicles. Then 16 states plus DC also adopted California's Advanced Clean Trucks rule, so looking at the heavy duty sector. So that's what has happened in the past. These waivers have been granted under both parties. There's a long history of granting these. And that's kind of where we are right now across the country with states that have adopted these standards. Key thing to note is that these waivers themselves, while the Advanced Clean Cars 2 and Advanced Clean Trucks are state regulations, the waivers themselves are not regulatory rulemakings. So the waiver from EPA that's granted from EPA is not a rule. It is just a waiver, similar to how maybe some of you are exposed to in the healthcare field, how Medicaid waivers work. It is not a rulemaking. Again, they've been granted for decades under both parties. But here's what happened this summer. So first, EPA submitted the waivers to Congress for approval. Let me back up here. Generally speaking, regulatory rulemakings must be submitted to Congress. Congress then has a window of opportunity, a like defined time frame that they can utilize a bad process called the Congressional Review Act. The Congressional Review Act, or a CRA, nullifies a rulemaking with a simple majority. So a passed CRA essentially wipes out the regulation, wipes it off the books, and then prevents the agency that issued that regulation from finalizing rules in the future that are substantially similar. So there is no other way to look at this. This is bad acting, point blank. The Lung Association, I'll note, does not support the use of the CRA, even if the tables are turned. So if the tables are turned and it's Congress trying to nullify a rulemaking that we don't like, we still will not support a CRA effort because it is just bad governing and overreach of agency authority. So that's the background. So remember, I said waivers are not regulatory rulemakings, and therefore they do not need to be transmitted to Congress. The Government Accountability Office just this year, I believe it was this year or late last year, confirmed that yes, waivers are not rules, point blank. But what happened is that EPA submitted three of the California waivers to Congress. So they submitted earlier this year with the new administration. They submitted Advanced Clean Cars 2 waiver. They submitted Advanced Clean Trucks, as well as a third waiver that was finalized in 2023, I think. Maybe 20, a third one that was on NOx pollution from trucks. So three waivers submitted to Congress. So that submission by EPA, which again, they didn't have to do that, but that submission, even though it was originally like when they were finalized, we were well past this window time frame that the CRA needs to fall under. We were well past that. We're talking like years past that time frame. The submission by EPA to Congress started the clock. And so that clock, again, governs the CRA opportunity. And so that was the setup. The setup was EPA submitted things that they have never needed to submit before. And then that was like, great, clock starts. Now we can use this bad CRA tool. So that was a setup. Second thing is the Senate parliamentarian that governs the rules of the Senate, which this is mostly a Senate play. The House is the House. These are the rules of the Senate. The Senate parliamentarian said, no, a waiver is not a rule, so you cannot use the CRA to overturn the waiver. This is not possible by Senate rules. This summer, the Senate essentially changed the rules so that they ended up passing all three of these waivers with a simple majority. So all three of the California waivers, so the clean cars, clean trucks, and the NOx, specific NOx pollution from trucks, got a CRA. So they have essentially been wiped off the books. So I said in the beginning that I would try to answer questions. And let me say right now that I'm sure there's a lot of questions on how this impacts future federal rulemakings for sure, but also the states that have adopted California standards, those Section 177 states. Know that first, there is litigation on this topic. So there are court filings challenging this action. And then second, while arguably the states that have used California standards now lack any authority to enforce these rules, as of yet, I haven't seen any uniform guidance issued on how states are supposed to proceed. So I think everyone right now is in a little bit of limbo, waiting to see how the court process plays out. And so I don't think I can answer questions on like, well, Connecticut was a state that I believe that adopted Advanced Clean Cars too. Like, how is Connecticut operating? I don't know. And I don't think anyone else really knows as well. Because technically, if there's not a waiver to do something stronger than the federal government, then the federal government standards are the ones that stand, which of course we know they're rolling those back. So all in all, this decision by the Senate to change the rules and pass the CRA is not only bad for health, obviously, as we've been talking about, and the climate, but I also have to imagine that it is a compliance nightmare for automakers to figure out how they're supposed to what standards do they need to meet. So again, waiting on the court process. And then I know that a lot of people are working on this issue to figure out how this impacts the states that have adopted California standards. Okay, almost through the definitions piece. So the greenhouse gas standards from vehicles. So this is also a very big deal, a big one, but unfortunately it's a lot more straightforward than the California waivers. And it has also received a lot of reporting recently. So you are likely familiar with it. So the background is that EPA sets greenhouse gas standards for all types of vehicles. They've been doing it for decades. The standards themselves are technology neutral, meaning that it's not an EV mandate, and they are performance-based. Each manufacturer has a target percentage reduction in greenhouse gas emissions for their fleet by a certain model year. And how they achieve that could mean zero emission vehicles. So it could mean that they put into production more electric vehicles that don't emit greenhouse gases to bring down their percentage. But it could also mean things like start-stop technology. So if you have a newer car, when you stop at a red light, sometimes your engine will go off, and then come back on when you need to start the car, when you need to move again. That's something that is a technology put in place to help meet greenhouse gas standards. It could mean hybrid vehicles or other pollution control measures, things that are put on the engines to control emissions. So it does not need to be electric vehicles. It just so happens that producing more electric vehicles is the easiest, most straightforward way to meet greenhouse gas reductions. So what has happened is that this summer, as part of EPA's proposal to repeal the endangerment finding, which is the scientific finding that greenhouse gases endanger health, and that EPA needs to do something about it. EPA is also proposing to repeal all greenhouse gas standards from all vehicles. Um, so there would no longer be any sort of requirements to reduce greenhouse gas vehicles from the federal government. Again, there's still some questions on like what could companies just continue to do this anyway because they're seeing that there's a market for EVs and a popularity. Of course, they can do whatever they want. However, we also know that companies often look at their profit and the bottom line, and if it is cheaper for them to continue to produce the vehicles that pollute more, then they're going to do that. So this is a far-reaching proposal, and it's also far-reaching in that it doesn't, unlike other um, unlike other rollbacks from EPA that we've seen. So, for example, EPA has also proposed to repeal the carbon rule that the Biden administration finalized, as well as a rule to strengthen mercury standards. Those repeals are strict repeals of a regulation. This is just no greenhouse gas standards. This is just a repeal of the issue itself. So this is far reaching in addition to the endangerment finding being a whole other topic we could do another presentation on being a big deal. So this is the latest thing. We are expecting them to finalize this rule by the end of the year. We don't have it yet. You can bet there will be a lot of litigation on this one as well, particularly from the endangerment finding side. But we do, this is a high priority for the agency. And so this is kind of, even during the shutdown, whatever limited capacity they have as a staff, they are working on this to try and get this finalized by the end of the year. Which then leads me to what hasn't happened yet, but is likely. So the greenhouse gas repeal that we just talked about is just the greenhouse gas pieces, the greenhouse gas requirements. The rules that EPA has put out on vehicles over the past few decades has measures that stretch beyond just greenhouse gas emissions. Because as we know, vehicles also emit air pollutants like soot and NOx. For example, the light duty vehicle standards that were finalized by the Biden administration in 2024 also included criteria pollutant standards, or multi-pollutant standards. And this included requirements for technology like particulate filters on combustion vehicles, which these filters are cheap, they are widely used in Europe, and highly effective at reducing PM 2.5 from vehicles. So again, these are what is referred to as like the criteria or multi-pollutant part of the standards. In the proposal on the greenhouse gas standards and endangerment, EPA sometimes went out of its way to say, like, oh, we're just looking at the greenhouse gas emissions. Like, we're not touching the criteria pollutant benefits of the light duty vehicle rule, for example. Like, those still stand. But it is widely expected that they are not done rolling back vehicle standards. So we are expecting additional rollbacks, additional actions coming from EPA, if not by the end of this year, like early next year, that look at other pieces of how EPA regulates the vehicle sector. So they're not done with the greenhouse gas standards from vehicles. There will be other things from both sectors, both light duty and heavy duty, that they are looking at. So when I am done and able to multitask, I'm going to put this article in the chat from NPR. I found this to be a great rundown of everything that I just went through. Obviously, in a 3-minute listen, in a much more succinct way than I was able to do. But I will put that into the chat so you have the ability to refer back to it. It was a great sort of rundown of both NHTSA and fuel economy, greenhouse gas standards, and California waivers. So it's a great thing to refer back to. So this is where I will try to inject a little hope and like what can be done because that's a lot of bad that is happening. At the federal level, there's no secret sauce here. It is just continuing to engage in rulemakings at every point, holding the meetings with OMB when rules are in review, attending the public hearings. I know that this community showed up a lot in the endangerment hearing, which was great. Submitting comments. Similarly, finding ways to keep the drumbeat going on messaging when there isn't a specific comment period to engage in. So on the endangerment and greenhouse gas findings, again, that comment period closed. We're still waiting on the final rule, but this is like a big, big thing that's happening. So how can nurses show up to help keep the drumbeat going on why we need these standards in place? On the legislative side, we know that there are going to be additional legislative attempts when the government opens back up and funding issues work itself out. We know that there will be additional bills that come through to weaken pollution controls, curtail electric vehicle adoption. There's a handful of bills that are out there already that aren't great. So be an informed and vocal advocate when it comes to congressional actions as well. And then recognizing that with a lot of dismantling at the federal level, a lot of NGO groups, a lot of advocacy groups are pivoting to states. So states are in this position right now where they're trying to figure out, some states, I guess I should say, are trying to figure out how to achieve reductions in transportation pollution without the federal government. So aside from standards, what can regulatory standards from EPA, what can they do? So supporting state and even more local initiatives to address zero emission vehicle adoption or to reduce pollution. So this could look like, purchasing more zero emission buses for your bus fleet with, whatever funding capacity you have. Looking at improving transit options, looking at the county fleets. If there's vehicles that are part of the county fleet, encouraging that those fleets are made up predominantly from zero emission vehicles. So there are things that can happen at the state and local level that can help to deliver real world health benefits to the local community by reducing pollution, and then also start to very slowly chip away at the broader problem of the greenhouse gas pollution and climate change. One thing else that I want to highlight in case it's something that has been coming up that I am learning a lot more on. And so in case you see it in your states, there is something called indirect source rules. So an indirect source rule is aimed to reduce pollution around freight hubs, which of course have become even worse pollution hotspots with the boom of e-commerce. A lot of people are getting their things delivered these days. So for example, these rules would help facilities like warehouses, ports, and rail yards adopt cleaner technologies like cleaner trucks. Cleaner trucks is a big piece of this indirect source plan because obviously these freight hubs have a lot of truck driving around. States could also include in an indirect source rule things like charging, solar power generation, electric cargo handling equipment. There is one, of course, again, California has been leading the way in a lot of these stuff. There is an indirect source rule for a locality in California that I'm blanking on the name that was put in place in 2022-ish or so that has done a lot of this stuff to try and improve air quality for those who are living around the freight hubs. The important thing to note here is that unlike California's vehicle standards, indirect source rules don't need EPA approval. So they don't need to go through the EPA waiver process like the vehicle standards do. States can work those things out on their own, at least for the time being. So this is something that we are looking at as potential to somewhat be a backdoor to pollution control from trucks specifically. So just wanted to bring it up because I know that it's been coming up in some states that we have been tracking. So in case you see it come up, we are always happy to be a resource on things that you're doing in states. I know that Millie and others at the federal level of Annie are also willing to be that. So if you see these things pop up and you're like, hey, this seems like a great idea that we can mobilize some nurses around in our state, reach out. I'm sure the answer is yes. So I think that's the end of my presentation. So obviously the landscape is pretty dim. I won't sugarcoat that. But it is really because of advocates that will be able to keep the pressure on our leaders to do better. So again, we are here as a resource. I know Annie always has action opportunities. We always share our action opportunities far and wide. So now I think I'm feeling a little more optimistic, especially after attending the Rally for Public Health yesterday. Now is not the time to get discouraged. It's really the time to double down. And nurses, you all know, are some of the most effective messengers. So show up as the effective messenger you are, and hopefully we'll start to set us up for a better future in a couple years. So that is my presentation. And I will
That
stop
was
sharing.
a phenomenal presentation. Thank you so much. I think all of us benefited from clarifying some of those definitions. It can get really confusing, even for those of us who are dealing with it every single day. I did put in, I believe the correct article link to the NPR article you mentioned in the chat, if you could just double check that. And then I went ahead and took the liberty of putting in an article from the Union of Concerned Scientists on indirect source rules. It's a blog post, but I think it can start to give us some. This is the first time I think that I've really heard about the indirect source rules. I may have heard about it, but it didn't sink in until now. So this sounds like a phenomenal opportunity to really look at the state level, and we do have a now I'm getting too excited and I need to ask, does anyone in our attendance have any questions that they would like to ask? This is a great opportunity now that we have Liz with us. Ah, Karen, I saw you were like, yeah, me. Okay, go ahead.
Thank you so much, Liz, for that presentation. It was really great and a great update about this, the hard thing about rulemaking, which is really difficult to understand. And my question is about California. I'm here in California and
Okay.
working with the California nurses. And I do think, and we're working with Annie, of course, very closely, who's done a great job in terms of advocacy. But I was wondering, I think the Attorney General has a suit out, against this, or pushback for our rulemaking. But do you have any other information about anything that's in planning or in the future about how California is going to fight back with this?
It's a great question. I believe I am not a California person, but I believe CARB is planning to issue new rules, I think. And then I think what that would set up, because it does take a few years. I believe what that would set up is hopefully for a future administration. Because while I say there's litigation on how everything went down with the California waivers, the CRA itself did not change the Clean Air Act. So the CRA that Congress voted on to overturn these waivers, they were very specific to those three waivers. So it was Advanced Clean Cars 2, Advanced Clean Trucks, and the low NOx rule called the Heavy Duty Omnibus rule. So it didn't change the Clean Air Act. Like, it didn't get rid of California Section 177. It didn't get rid of California's authority. That still is there. it makes it more complicated. But this is why it is complicated to figure out what the future looks like, because technically the authority still stands, but they CRA'd a waiver. And remember, I mentioned it maybe in passing, but the Congressional Review Act, one of the provisions of it is that what makes it so scary is that not only does it overturn that particular regulation, it also prevents the agency from finalizing something substantially similar. And no one really knows what that substantially similar is. It's largely untested. So there's a lot of complexities here on how this impacts the future. I know CARB has doubled down on we need to protect the health of our residents, and so we're going to do what we can do. So I believe there are additional rulemakings in the works, but I don't know much more beyond that. But I'm happy to check in with our California folks for a better answer to that.
Thank you. That's actually very helpful. And the other thing I didn't know is I think you mentioned, correct me if I'm wrong, that there were 11 states that also had expanded the similar rules in terms of the protection, the protection for low emission vehicles, et cetera. And I hadn't heard that. Do you know of anything else going on in the other states similar to what I'm asking about in California?
I think everyone is still waiting to see how the litigation plays out, because while they don't have they don't necessarily have the authority to enforce the rules, because the rules are based on something that doesn't exist anymore. So they don't technically have the authority to enforce it. But again, as I said, I have not seen, I could be missing something, but I have not seen any sort of like guidance saying like X state needs to stop, like Maryland needs to stop enforcing. Some states, I will say that they may just make the determination to stop doing it on their own, because they're like, well, we don't want to get ourselves into a mess in a few years by doing something that we weren't supposed to do. So I don't know is the short answer.
Well, and it's also just helpful to know that there are several other states, if possible, several states.
Oh, you muted yourself, Karen.
Fine. Several states could go together with California to oppose, the government in the feds in this rulemaking. I don't know if that's happened. It may, but thanks very much for that information, because it is something that's emerging.
Yeah, there was a lot of engagement. There was a ton of engagement, and I know Annie was involved as well with some ads when all of this was happening in Congress back in May, June, earlier in the summer. There was a ton of engagement, certainly from the states that have these rules, from NGO groups like ours, public health groups. So yes, there was a ton of engagement, and it was incredibly disappointing to see how we ended up. And the more disappointing thing was that they were all bipartisan votes, unfortunately. And it just goes to show that the messaging, not only is the messaging around electric vehicles challenging, certainly for some moderates, but also the issue of the messaging around why California gets this special treatment, the opposition to these, or those who were supporting these CRAs, really latched on to the message of like, why do I need to do what California does? Like, why is California telling me what to do? And that's not what the Clean Air Act says. All of these states that adopted California standards go through their own rulemaking process. So everything that a state does to adopt a regulation, they go through that process. And if through that process they decided, no, this isn't the right course for us, then they could abandon it. They don't have to. It is if they choose to do that and they see the benefits of what this regulation could mean. So we really lost the messaging fight around these CRA votes. And so it did end up being bipartisan votes to overturn them. So I think there's still quite a bit of work to do on the messaging landscape around electric vehicles and this particular piece of how California can lead the way for other states to do the same.
Thank you. Thanks very much. Very good information.
That's very helpful. And actually, leads into my next comment. You mentioned how nurses are the most trusted profession, and I think this is a great opportunity to expand that trust into a place of influence. And so when we have educational webinars like this that really break things down and explain the definitions and the meaning of it at from our health lens, it empowers us to then go forth and be able to explain and connect the dots in a way that lends itself to influence. And so, thank you again. I have heard, I'm going to play devil's advocate. Is that the right term? I don't know, but you'll get what I mean. I have heard from some of my nursing colleagues out there that are very disheartened by the turn of events. There's this feeling of what is the point of submitting comments and so on and so forth when they'll likely be ignored? Do you have a word of encouragement in terms of continuing supporting the science, even in the light of what's happening?
Sure. It is hard and it's something that I struggle with on a daily basis, but I will have my response that I give to anyone who asks why we meet with the Office of Management and Budget. So for those of you who have not joined an OMB meeting before, they're called 12866 meetings. They used to be in person. I joined one in person at the start of my career at the Lung Association. And then now they are all, during COVID, they switched to phone calls and they just have not gone back. So they are just a phone call, not even a Zoom or anything, literally just a conference line that you dial into and you speak into the void. And there are no questions because they're protected by the phrase of we can't comment on ongoing rulemaking that are under review. So you just talk into silence for 15 minutes and then there's no questions and say thank you for your time and you hang up. And it can feel incredibly performative. And like, why are we doing this? And I say two things. Number one, it is so important to build the record. So even if there is something that there is nothing that can happen immediately, or even in the next year, in the next 2 years, in the next three, it is so important to build the record for when we are in a position of favorability towards zero emission vehicles, towards climate action. We can point to we brought up these concerns. This is why you have to undo this bad rule that you did. So it's very important to build a record. The second thing I'll say is that the opposition is in the room too. So the opposition is having these meetings. They have the ear. Why would we let that go unanswered? Even if they glance at it for a second, if they see a headline, because a lot of the advocacy that we do when we are in situations like this is less for the audience that the advocacy is pointed towards and more for how that advocacy opportunity can be amplified to the general public. So the more that they see getting pinged from news clips on on how we are opposing this, then even for a split second, what do they say about advertising? You need to see something like 7 times before it like you act on it. It's the same thing. So it is important to build the record. The other side is there too. So why would we let it go unanswered? And then this is much more of a public galvanizing than a pointed direction to someone who won't listen to us, whatever, no matter what we say.
Spot on, perfect. And I will say to your point that having gone through several Hill days and been to legislative offices, many of which, due to my colleague here today, Sarah Buchik, who wonderfully arranges these opportunities for us. I am sometimes surprised at the unintentional lack of knowledge on how, at the grassroots level, these legislative policies are actually what the consequences of what they will and are doing at the grassroots level and what that looks like until there's somebody, a human being in front of them and explaining it, in a way that makes sense to their constituency. Um, it's kind of like people are with, and all of us are kind of like we're here to do our job, but it's a moment in time where you can open that person's perspective and plant a seed, and maybe nothing will come of it, but maybe down the line something will. And so that's always important. You mentioned how nurses could begin to look at keeping track of things like you talked about. What was that? I put it in the indirect sources rules. And this is like looking at the state level. And more, we need to look local. Even as we think globally, we need to think very, very local. And I just wanted to put out there that one thing that makes a lot of sense when I hear that is advocating for something called active transportation. And sometimes if you're living in a certain place where your language has to be very careful, um, as you promote clean air and cleaner transportation, maybe you talk about the solution and offer, bike paths that are protected and more pathways towards walking, and you couple that with the health benefits. Um, and two roads can be parallel to each other and built at the same time. And so while you're working on that electric vehicle, you can also offer those solutions that are directly in our line of health, active transportation, of course. And well, I don't know where I was going with that, but you inspired me to say that. So I put it in the chat, everybody. Um, anything else? I do have one more question, but I want to make sure that I'm leaving it open for anybody who has a comment or a question. We only have about 5 minutes of Liz's time left. And if not, you guys know I can talk. Oh, what's that? Okay. Nobody? All right, then it's me time again. Um, One question that we received is it's sort of a play on everything you've talked about, but in a slightly different angle. How can nurses be most effective considering all the progress in recent years getting rolled back um, within their institution, within their practice setting? Like, how can we make that connection to, I mean, we're talking about big words here, big phrases, greenhouse gas emissions and how do we translate that at point of care to our coworkers, to our leadership within the hospitals?
It's a great question. I think you all know your hospitals better and what the consequences of being the one who tries to start these conversations in your work setting. But I think it is very similar to how you would chat with your community and your family on the importance of, and it's not, you don't need to get into the weeds of, oh, we need to make sure that California has its authority under the Clean Air Act to receive a waiver from EPA to,
Right.
have cleaner vehicles. It is, hey, you see that bus that just is in front of our clinic, and you see the puff of pollution that came through it. There are better alternatives available. I wonder if we can uh, get a group together and go in front of city council, whatever it is, as nurses, and to say, look, whenever this comes through, we've got patients who are coming in and out of our doors that are being harmed by this puff of smoke. And we know that there are other cities that have been adopting or cities that have been looking at buses that are zero emission, and that therefore our patients won't have to come see us to treat a symptom or to treat a chronic disease and then have everything that we do, nearly everything we do, get wiped out the second they walk out the door because they just walk directly into diesel smoke.
Yes.
So I think it's putting it into the local examples. And you can't get a better example than buses. Same thing with if you live near a trains or a freight hub, um, making it making your colleagues picture it and putting it next to this is contrary to what we do here by protecting patients, and make that connection for folks.
And I would add even by Karen, um, even suggesting that your institution take ownership for its own transportation in the form of ambulances and the supply chain. You know, who are could we do better in terms of transitioning to electric vehicles within our own hospitals as we send them out to, to places and people that need the help? What can we look at in terms of, can we contract with suppliers that are more green than what we have traditionally been doing, which is more cost savings um, related? Because it does, to your point, Liz, begin this sort of vicious cycle that communities can't get out of. You have a high asthma rate and you're brought into the hospital, and then you go back out into the community and into all that diesel. So it's very complicated, but it all starts with the suggestion of possibility of change and reframing that question. What could it look like? And what that often is right in front of us, and what that looks like. Oh, you're welcome, Clara. Well, I think she was saying thank you to you, but um, that was extremely helpful. Liz, I can't thank you enough. So I'm going to end today's webinar here. This is going to be shared out with our members. If anyone has a question, please let me know. A question for Liz, please let me know. I'm going to chat. I'm going to drop my email in the chat, and you are more than welcome to email me, and I will send it off to Liz. All right. Thank you,
Thank
everyone.
you. It was a pleasure
Thank
to
you.
talk to you guys.
Take care. Have a good day.
Bye.
Bye-bye.